going. So without any further ado, my friend Steve Thorne from Pacific Dental.
Hey, you were right.
Hey, thanks, Steve.
I said I didn't do Fridays anymore, and good turnout. Good
Well,
job.
this is
Thank
great
you.
for a Friday, and I'll just say he flew up specially for us today, and that's not lost.
And now we're PDS Health, so
Yeah, well, all right, yep,
Thank
well,
you.
yep.
I'll tell that story a little bit right now for all of you. Yeah, and it's great to be here. Thank you for having me. I heard I didn't get here till this morning, but I heard yesterday it was jam-packed and really exciting. It's one of the best meetings going on in dentistry today. This is me and my mom. So my mom was an incredible woman and very important part of my life. And she was an incredible encourager to me and a confidant in me in those early days when I was trying to get PDS started. And it was really hard in those early days. As some of you know who are starting DSOs or have started DSOs, it can be hard, and you really need that encouragement. This is her, and this is her and her grandma. So my mom and I were really close, and we had breakfast one morning in Newport Beach, California in 2006. And we were both really busy. I had 7 kids at that time. She had divorced my dad and then had gotten remarried, but we still found time to get together. But she was always really confident with me and where we were going with the company, because she had been married to my dad for 30 years, so she got to see firsthand what it was like to live with a dentist, a clinician, who had to operate a practice and a business at the same time, and all the stress that created on him and the marriage. So she was a huge supporter in me and what I was doing, because she knew the impact we could have on clinicians, or that I could have on clinicians. And so she was an important part of that whole journey. But we're having breakfast that morning in 2006, and we're just yapping. And I told her that she was looking great. She was a vibrant 65-year-old, and she said, yeah, I'd just been to the doctor, did one of the GP, cardiologist, and doc said I'm healthy. Got a great heart, all my scores were good, all my standard scores were good. Her CAC score, if you know what that is, a calcification score, was a 0. He said, you've got incredible genes, you're probably gonna live to be 100 years old or so. And we laughed about having those great genes because we were gonna go visit my grandma for her 90th in 2 weeks. And this is my mom and grandma at that 90th, and then this is me and my mom at that 90th birthday. I didn't know at the time, but this would be the very last picture I had of me and my mom. She died 2 weeks later, 65 years old. I remember getting the call when I was in the office that day from her new husband, and he was unintelligible, so I raced to the hospital to try to figure out what happened. And she died of a massive stroke at 65 years old, way too young. I didn't know it at the time, but this incident would be part of my journey to figure out about my health, but also a key part of the PDS journey as we moved forward into PDS Health. So I'll wrap all those together. See, I come from a family of dentists. I think some of you know that. I said my dad was a dentist, but my grandfather was a dentist too. Graduated Harvard in 1939. Practiced for 50 years. My dad practiced about 50 years. 2 of my brothers are dentists. They're not pictured here. But one's even a periodontist. And during that time, the connection between oral health and overall health was never talked about. All that was new to me at the time. And so So it was really odd when I started to dig into what happened, because I wanted to find out what happened to my mom, and my mom had always struggled with oral health, even though she was married to a dentist. And I started reading so much about what was going on about cardiovascular disease and things like that. And I was amazed about the connections in these articles early on. It was all new to me at the time, of the connection between oral health in these articles to cardiovascular health, which is what I was primarily looking at the time. But I soon learned that it was all about inflammation, and inflammation was the silent killer in all this. Inflammation is what killed my mom. Now, she didn't die of oral health, but I know it was part of it. And inflammation is that silent killer that affects so many chronic diseases in the United States, whether it's cardiovascular disease, dementia, and diabetes, and things like that. The CDC says that every 33 seconds someone dies of a cardiovascular event, more than all forms of cancer combined. And so I started researching more and more and studying this, and the articles kept popping up with oral health being a component of a risk factor for cardiovascular disease. And since I was in dental, I got really interested in this and started studying this. I read the Surgeon General reports. From the first Surgeon General report on oral health in the year 2020, in the year 2000, I think it was Dr. Satcher that said, oral health is integral to general health, and you cannot be healthy without oral health. And then a follow-up report in 2010, where I think it was Dr. Regina Benjamin dug down deeper and said how important oral health was. And then if some of you probably saw the 2021 report that was like 700-800 pages long. All of that stuff really got me interested in, hey, what's going on here? If you look at most of the research around the connection between oral health and overall health, and it's not just periodontal disease, it's abscesses, it's tooth loss, there's so many areas that it impacts. Most of the research and studies were from about 2004, 2005 on, after the first Surgeon General report. We literally have thousands in our database of it now. And so it intrigued me how this process, what was happening with all this research and science that was happening. So part of our job as leaders in this room is to try to figure out where things are going in our business or our practice, or maybe it's our community, the state, the world, whatever we're dealing with. We're here at with a bunch of DSOs. I remember back in the day when DSOs were persona non grata, basically in every state, and we were fighting all those fights, but we had to figure out where the industry was going and was it worth the fights to go after. There's actually a military term for this, for all of us leaders, OODA, observe, orient, decide, and then act. And studying these things are important. Or another famous overused analogy is be where the puck is going, and trying to figure out all of that. And so I was studying these papers, and more I got to things around, the studies were around saliva and how important saliva is to our bodies. I don't know if you know this, but we swallow about 1 liter of saliva a day. That was a shock to me. How many of you knew that? Probably hardly anyone, unless you're a clinician, right? 1 liter of saliva. And guess what's in that saliva? Yeah, there's a lot of bad stuff. There's some good stuff. But health starts in the mouth. Health is the gateway to the mouth. You can look in somebody's mouth and figure out how inflamed their arteries are. oral health starts in the mouth. So studying saliva, I learned about all the ways the saliva and the things in it, bacteria and enzymes and inflammatory mediators, were affecting my body and others. This is just a graphic of some of the areas it affects. And this is all based on proven science. Now, some are associated risks, and some they're now saying are causal. If you're in catching some of the, or if your feed on your phone has some of this around saliva science, you'll get something new every week on your phone around this area. But it affects so many areas, and I go, wait, we've got to figure this thing out. I put together a task force. I've been reading all this myself, kind of a skunkworks project in my company, by myself. But by 2015, I figured we need to do something about this. I put together a task force. 15 people on it or so, physicians, nurses, cardiologists, all sorts of different people. I wasn't on the task force because I didn't want to be biased. And so I asked them to go look at all the literature out there across the world. Is this stuff real, or is it kind of pseudoscience? Remember, I'd grown up in a family of dentists. They were good at doing crowns, they were good at placing implants, placing dentures. Okay, but we weren't talking about the connection between oral health and overall health. And they came back and they found out, and they came back with a paper to me and said it was real. This stuff is so real. And so many universities were getting in it. I'll show you some of the studies in a minute. And big universities. I mean, you're talking Harvard and Michigan and then other big institutions like Mayo Clinic and others. During my journey of learning all of this, I started investigating the specific bacteria in our mouths that were either associated or causal to these systemic diseases. Up on the screen, you'll see a list of, I think, 12 of them. And on this journey, I met a couple of doctors, and I was still really investigating cardiovascular disease at this time. But I met a couple of doctors, Doneen and Bale, who had done a peer-reviewed study around 5 of these bacteria where they stated were causal to atherosclerosis. Okay? And at that time, it was still not widely accepted, and so and it's probably still not today, so there's some debate on some of this stuff. But there's an overabundance of science and data to support this. So it wasn't just their paper that interested me. What they said in the paper was more interesting to me, because they said, look, periodontal disease is a medical problem with a dental solution. It's a medical problem with a dental solution. Dentists need to take that to heart, and they need to step up their game, because what they do, not only do they fix teeth and help people maintain their teeth and gums, but now they can help people save lives. They can help save lives. And they even went one step further and said, dentists need to be on every patient's primary care healthcare team. That's what hit home. So we at PDS at the time, it was Pacific Dental still, we called it the mouth-body connection. You're welcome to use that term anytime you want, because I want to help people, but send me a nickel every time you do, because we own it, okay? The link between oral health and overall health and systemic health, and the role that it plays and the role that is harmful bacteria and inflammation and bone loss in our mouth play in chronic systemic disease. The way I think about it, okay, for years we've been really good, and I like this picture, because at years we've really been good at taking care of and navigating through what dentists could see, helping them get better and better. That's what we do as a DSO. What they could see, x-rays, digital x-rays, moving to CBCT, all the things you guys do, all the tech, okay? And really helping them be great at it. But we had never moved that to what they couldn't see below the surface, and how we could help people understand the effect oral health has on their overall health. And it was at that moment I knew I wanted to change that. Some of you know I got started by working in my dad's dental office. I found this old picture. This is the office I started in. Crazy. In Victorville, California, by putting in a computer system in my dad's office. I learned the business from the ground up. And I worked with him for a little while, but when I was in his office, he started dumping everything on me. So I got to learn firsthand how he didn't want to deal with the business side too. So again, validating the DSO business at that time. I managed my first office in Barstow, California. How many knows where Barstow? Okay, halfway between LA and Vegas. It's the McDonald's pit stop. That's what it's known for, right? But it's a big train community and a farming community, and they have great insurance. So the business was pretty good. But I got to learn the business from the very bottom, which has been critical to the success, I think, of PDS all along. This is a picture